Good evening. I'm Brigadier General Paula Lodi. I'm the U.S. Army Medical Command G357. I'm here in Europe on behalf of the Army Surgeon General, General Scott Dingle, and we're synchronizing the COVID-19 responses between Regional Health Command Europe and U.S. Army Europe. The entire Army team is working as a whole to mitigate the spread of the virus. Here in Europe, we're following guidance and monitoring the situation to mitigate risk to force in accordance with guidance and direction from the Center for Disease Control and Prevention, the World Health Organization, and European Command Headquarters. Our mission remains the same, to maintain operational readiness and protect the health of the force. We continue to work closely with the host nation in Europe and to ensure our policies align with local and national response plans and keep our Army team informed on our efforts to fight this global pandemic. We work every day with our allies and partners to be good neighbors and fight COVID-19 together. As always, the health and safety of our service members, civilians, and family members is a primary concern. We continue to do our part to prevent the further spread of the virus while still maximizing our efforts to advance our alliances and partnerships and enhance our comprehensive readiness to address any crisis or contingency. Now, we cannot do that without your help, and we need you to take appropriate actions to protect yourself and those around you by employing protective measures, including practicing hand washing, physical distancing, and appropriate actions if you start to feel the signs and symptoms of COVID-19. Thank you for joining us today. We have an outstanding team of experts gathered who can answer your questions and provide the latest information about our capabilities and our posture so that we can remain Army medicine and Army strong.
I'm Colonel Andre Pippen, Regional Health Command Europe Commander. We're grateful for the opportunity to answer your medical questions related to COVID-19 and to talk about the efforts the entire Army team is taking to protect our service members, civilians, contractors, and their family from COVID-19. By now, most of you have grown accustomed to many of the changes that we have had to endure. But I know there's still a lot of concern and anxiety out there. Rest assured that we are doing everything in our power to protect the safety of the force. Once again, we have assembled a team of subject matter experts to answer your questions. And as you can see, we are doing this via VTC to not only emphasize, but to practice physical distancing. Thank you for joining us, and keep those questions coming. Over to you, Command Sergeant Major Baller.
Well, thank you, sir. Good evening, everyone. I am Command Sergeant Major Matthew Baller. I'm the Regional Health Command Europe Command Sergeant Major, and I first want to thank everyone for joining us this evening. My heart goes out to everyone out there who is dealing through this difficult time, especially if you have a friend, family, or a loved one who is going through this COVID-19 crisis and is not doing so well this evening. Our hearts and prayer are with each of you and your loved ones. I want to thank you all for all the efforts that you are doing. The physical distancing, washing your hands, avoiding touching your face, your eyes, your nose, and your mouths. What you are doing is working. And so we ask you, please continue to do those things to make sure that we keep one another safe, yourselves safe, your family members, and all of your loved ones. Thanks again for joining us this evening. I know many of you have several questions, and hopefully we've gone back and answered all the questions from our previous town hall. And if there's any questions that we do not get to this evening, we will go back through and answer all of your questions on our social media website to make sure that everyone receives a proper answer to your important questions. Again, some reminders that we're going to focus on COVID-19 issues. So please limit your questions to these issues and so that we can focus our efforts on COVID-19 and our responses to those concerns. Secondly, we ask that you do not use personal health information. So please avoid using any personal information in reference to ages, names, circumstances that might reveal someone else's identity. Third, we only have 60 minutes for this evening's event. So if we don't get to your question, again, we will do our best to go back and answer your questions online in the coming days. And with that, let's get started with your questions. All right, so I'll begin the questions this evening, and it comes online. It's a question we received previously, and this question is for Colonel Freeman. Colonel Freeman, it is allergy season. How do we explain to people the differences of symptoms so we ease the fears and people do not rush to think they have to be tested for COVID?
Good evening. I'm Colonel Randall Freeman. I am the Deputy Commander for Health Readiness at Landstuhl and Landstuhl's medical lead for COVID preparedness and response. Both allergy and COVID infection can have some similar symptoms, including having coughing and in some instances, some effect on breathing as well. However, if a chronic cough changes in character, or if difficulty in breathing becomes significant, if there's fever associated with it, along with other symptoms such as body aches and any GI symptoms or anything different that changes that's not what you have typically experienced with your allergies, those are all indications to go in and call the nurse advice line, call your primary care provider, and get screened for possible coronavirus infection. Thank you.
Thank you, sir.
This question is for Colonel Codron. What should I do if I think I'm having COVID-19 symptoms?
The very first thing you should do, the minute you feel like you are having symptoms, is to isolate yourself from other people. Whether that be at home, whether that be in your workspace, you need to immediately ensure that you are not coming into close contact with anyone else. If you're not at home, get there in a manner that also avoids coming into close contact with anyone else. You and your family now are under isolation. You will have to remain there until cleared. But you obviously will probably need medical care, or at least desire medical care and a test. So once you arrive home and you are away from everybody else, please call the nurse advice line or your primary care provider as soon as you can. Thanks.
Thank you, sir. Our next question this evening is for Colonel Freeman. Colonel Freeman, this individual is having trouble getting through to the appointment line. How does this person get in touch with his or her primary care team?
So the appointment line has been experiencing high volumes of calls. I would encourage you, please continue to keep calling. Sometimes it takes multiple attempts in order to get through, but please continue attempting to call the appointment line. It may take 3 or 4 different tries, but that is the best way to get hold of your primary care provider. You also can make appointments in TRICARE online, so I encourage you to register for that, and that is another modality in order to get access to health care. Thank you.
Okay, this next question is for Colonel Catino. What types of underlying medical conditions make a person more susceptible to contracting COVID-19?
Yes, ma'am. Colonel Catino, I'm Chief of Clinical Operations here at Regional Health Command Europe. So there are a whole host of different types of medical conditions, chronic conditions, which means the person's had them for a number of months or years. We always like to start with the chest and speak of heart disease. So anyone with underlying heart disease, whether that's coronary artery heart disease, valvular heart disease, cardiomyopathy, hypertension, high blood pressure, that's one. Number 2, any lung disease. That could be asthma, that could be one of the rare types of lung disease diagnosed by a pulmonologist. Number 3, any type of condition that lowers your immune system. So cancer, and I'm not speaking of the small little lesions that sometimes we get on our foreheads when we're in our 60s and 70s that the dermatologist takes off. I'm talking about cancer where you're receiving active treatment for, and it's affecting your health, and you may be on different medications that lower your immune system. The next one are any other conditions that are similar to that. So any other condition that lowers your immune system, and that's usually by virtue of being on a medication that lowers your immune system. So rheumatologic conditions, rheumatoid arthritis, where you're on a biologic agent or something like methotrexate, those certainly would be conditions as well. Otherwise, any other chronic condition, for example, liver disease or chronic kidney disease, those two would be conditions that you would want to be aware of, because that will place you at a higher risk of developing complications should you develop COVID-19 infection. Thanks.
This next question is for Colonel Freeman. This person wants to know if she is at a higher risk if she is pregnant.
So it is not fully clear yet what level of increased risk pregnant women may have from coronavirus infection. There are other viral infections, such as the flu, for example, that do place pregnant women at a measurably higher risk. We're not yet sure exactly the effect that coronavirus has on pregnant women, if it does indeed, if they are indeed at much higher risk for complications from that. That being said, pregnant women are encouraged, the same as anybody, to practice social distancing, to ensure that they're wearing masks, if they are infected so they won't infect anybody else, and to practice good hand hygiene in order to keep from getting infected themselves, the same as we would direct any other patient. And please make sure to follow up. If you think you may be infected, follow with your obstetrician as soon as possible. Thank you.
Okay, this next question is for Colonel Caldron again. Are you planning to increase testing, start to test asymptomatic persons, or will testing get less and doctors diagnosing persons with COVID be based on personnel with symptoms only?
Those are actually several questions, and they're excellent. I'll start from the end and work backward, and if I forget anything, please correct me, ma'am. As far as clinical diagnosis, reducing the testing to do clinical diagnoses, there are some situations in which I would myself not necessarily want to go to a hospital to be tested, but these situations are best discussed with the primary care provider. For instance, if I'm the spouse of a known COVID patient and 3 or 4 days into our joint quarantine, I develop the exact same symptoms my spouse has, that may be a case where a clinical diagnosis versus a laboratory diagnosis might be indicated. But right now, we do not have any plans to decrease the amount of testing that we're doing. People with symptoms can still get tested. And in some fairly rare exceptions, asymptomatic individuals can be tested as well, although that is largely discouraged by the Centers for Disease Control to really target our laboratory capabilities towards those who most need the diagnostics. But thank you for those questions. They really are good.
Okay, our next question is for Colonel Pozo Alonso. Are you still seeing dental patients right now?
Yes, we are seeing dental patients, but we are only seeing emergency patients. And by emergency, what we mean is somebody in severe pain, has some bleeding or like a major infection. We are also seeing some dental exams for soldiers that are deploying at the present time. But besides that, it's either that or the emergent patients at the present moment. Thank you for the question.
Thank you, sir.
This question is for Colonel Contino. What is the status of the rapid COVID-19 test? I've read that it's been newly developed. Will your MTFs be receiving this capability if it is available?
So another good question. Thank you for that. So the rapid testing is done on a machine that doesn't do a lot of high volume testing, but one nice thing about it is that it churns out to the result in about an hour or so, give or take. And so we've decided to put it especially at places that may be a bit of a drive to law and shul. Most of our clinics are within reach to bring specimens from, let's say, Stuttgart or Cleaver over, but far more remote locations, we have decided to put some of the small numbers of the rapid tests there for now. And then when we receive more, we'll work our way in. So at Shape and Vicenza, for example, they have an instrument called the BioFire. In addition to COVID-19 testing, which is one of the main reasons we're sending it there, and it's there and working, it also tests for other things like rapid flu and rapid strep. So it has the ability to do quite a few things in a relatively short period of time, so we like it for that. As far as expanding that testing, that's all on the books to happen. We don't have an exact timing of the arrival of the different rapid testing devices, and there are different names for those as well. But we expect at least to be receiving some more in the next several weeks, and we'll have more updates as they become available. Thanks again.
Okay, Colonel Caldron, I'm going to give you a break from the questions because every time I get a question come up, it's for you. So I'm going to try and take a stab at answering this one and correct me if I say anything that is inaccurate. The question is, if you're tested for COVID-19 possible exposure, for instance, in the same building but not at the same area but in the same time frame as somebody who does test positive, and the test comes back negative, and you receive the results saying you're negative but are still told to self-quarantine for 14 days, the impression is that we're told to follow CDC guidance that says 14 days from exposure, and in this case we're probably telling you to go a little bit longer. You know, I will say that the USER commander's guidance down to the senior responsible officers are to use every precaution possible to make sure that we stay safe and that we do our part to flatten the curve. And so there are cases where even though the CDC guidance says 14 days from exposure, the USER CG has left it to the owning commander at their discretion based on other factors, for instance, what's going on in your home or what else is going on in your work area, and perhaps whether or not there's a real mission essential necessity to even bring you back to the work area, and that if none of those conditions exist, then go ahead and stay on quarantine for 14 days so that we can be sure that you're not risking yourself or your other co-workers or your family members unnecessarily. How did I do, Colonel Contino?
Awesome, ma'am, and Colonel Caldron would probably say the same thing. Over.
Okay.
Okay, so this question is from Colonel Contino. If I'm a positive COVID and single, can I go get groceries? And how can I get food, mail, personal items, etc.? And what actions should I take to protect myself and others?
So upon hearing that you're COVID positive, hopefully you are already being isolated. So you would continue to isolate in your home. It's always best to follow the guidelines. So that isolation means, no, you would not go out and get groceries or your mail or gas. You would want to leave that up to somebody else. As far as the precautions go, I can think of a couple different situations. One would be where you have some family members. So the best thing in those cases is to have them use a different bathroom and other hand washing sinks and things like that, and other household items and surfaces. So stay away from that if you're COVID positive and your family members are not. They're just a contact. If you're single, though, as the question said, you would just continue to isolate in your home until you've been in there for 14 days and had no symptoms for 3 days. In some cases, there are testing requirements to get out of that isolation status and back on to your work, whether that's telework or in person. So again, in summary, stay at home, get somebody else to do those important things. Yes, food is obviously very important, as is taking care of your business with mail. So find somebody that you know through your unit, through the family support group, and protect yourself and the community. Thanks.
And Colonel Contino, I'd like to expand on that a little bit more. For everyone who is going through this situation, especially for a positive COVID test, your unit and your leaders, friends, and support group here in Europe, we're all here to support you. All of our units are well versed in taking care of soldiers who test positive for COVID. You would stay in your barracks room if tested positive, as long as you have direct access to the latrine. If your roommate, you have a roommate in your room, that individual would also be quarantined along with you, and your unit will take the necessary measures to make sure that you are getting food, you are getting support for any groceries that you may need, the lickies and chewies that you are accustomed to having in your room. And also, depending on the time frame, your unit leaders know how to help and assist you with your laundry needs as well. So we are here to support you in any way that we can, but rest assured, we want to make sure that you get healthy and return back to duty as soon as possible.
Okay, this question is from Colonel Coldren. If someone in the same household gets quarantined, what does that mean for the rest of the household? Should they be working if essential personnel with the risk of cross-contamination?
Sure. So it actually depends on the reason why their family member has been quarantined. If the reason that they've been told to self-isolate is because they have COVID, then everybody in that household will be quarantined for a period of 14 days after the sick family member ceases having symptoms. If, however, the family member has been told to self-isolate because they are a contact of somebody, say at work, and the rest of the family is not a contact of that person, then no, those family members are not quarantined along with the individual who is a close contact, unless that family member was a close contact developed symptoms, and then that would be a presumptive case of COVID-19 until that person is evaluated by medical care. So again, the short answer is if the family member was told to self-isolate because they were a close contact of somebody outside the household, the other members of that household are not in quarantine.
Okay, our next question is from Anna, and this question is for Colonel Coldren. Do you recommend self-test swabs available from the economy, especially for us GS employees? What are the pros and cons?
I have to confess that I am not particularly familiar with that one kit, so I'd be uncomfortable answering it at this time, but I can look into that and get back to you as soon as I can.
Thank you, sir. So Anna, we will respond on our Facebook page and make sure we get you an answer back to your question.
Okay, this question is from Katie for Colonel Winans. The kids are back in virtual school. I'm still teleworking, and we're getting back in the swing of things, but I need help because I'm losing my mind. What kind of behavioral health options are available for me?
Well, first of all, Katie, it sounds like you've got a sense of humor, and that is very, very helpful in times like this and can be taxed, but it's a good start. So this is Lieutenant Colonel Emil Winans, Chief of Behavioral Health at Regional Health Command Europe. So I first and foremost realize that while we're unclear how long this quarantine and the current phase that we're in of COVID-19 is going to last, it is, in fact, time limited. Now, a lot of things have changed. It's not clear how many things in the future will change, but it is time limited. And so that's an important thing to keep in mind. Second, I think doing whatever you can to maintain a routine. It sounds like you're already doing well with the teleworking. it's going to be, obviously, as you mentioned, challenging for your kids. So I think the third thing to do is keep them involved and in as much of a routine as possible. So that should involve everything from intellectual and artistic and physical stimulation. The weather's getting better, so getting kids outside. A lot of spent energy can be used effectively when they're outside, keeping them, inside their community at home or in their backyard. I think fourth, it's also good to talk with your kids. Again, it'll depend, Katie, on the ages that they are. And so how much you tell them and how you tell them and what you tell them about COVID is important, but certainly being calm, modeling good, reasonable, sensible behavior as best as you can will be helpful. And also, if there are times, as you say, you're going crazy, where you lose your cool or somebody in the family loses their cool, which is quite predictable and normal and natural, frankly. This is we do on vacations, and we spend a lot of time with family members in a close environment. Talk with it, talk it out, talk about what caused you to lose your cool, how they can help mommy, how mommy is trying to help them, how dad, again, if all the parents are at home, can help, and try and regularly communicate in ways that might be a little unusual for the family. But nevertheless, this situation does present an opportunity, challenging as it is, to open up some lines of communication. Now, that is going to take some real effort, I think, and some courage and bravery, but it can certainly be done. But most of all, try and find a sense that things will pass. Again, important things are communicate, routine, get what physical exercise you can. Diet is also important. Watch out for excessive amounts of alcohol. And then finally, sleep. Sleep is probably the least expensive and probably most effective stress management tool known to mammals. So that's what I would pass along to you, Katie. And if you do need additional assistance, on top of reaching out to friends and family members, contact your local MTF, behavioral health clinic. We're doing on the order of 90% of our appointments these days via telephone or video teleconference. So there's also assets there. Thanks for the question, Kate. Good one.
Okay, this next question is for Colonel Freeman. What exactly does prolonged close contact mean? What time frame are we talking about to have an increased risk of getting infected?
So thank you for that question. Close contact is, as defined by the CDC, being within 6 feet of somebody who's positive with coronavirus for at least 10 minutes or more, or being in some sort of a confined space with them for an extended time period as well, or having exposure to body fluids such as droplets, respiratory droplets from sneezing or from coughing, something of that nature. You may also even be exposed through using the same bathroom or the same kitchen as somebody with coronavirus if you're exposed to respiratory droplets that they've left from coughing or sneezing on surfaces. So all of that lends itself to close contact. If you are just in physical close proximity with somebody who may be coronavirus positive, but they have a mask on for that period of time, so they're not expelling respiratory droplets, and you are not exposed to using the same bathroom as them or anything of that nature, then that you would not be defined by the CDC as a close contact, even though your physical distance may be within 6 feet. So that's why it's very important for everybody to make sure that they follow the guidelines that have been put out there about wearing masks all the time, to make sure that we don't impact each other and affect each other if we are within that 6 foot distance. Thank you for the question.
Okay, the next question's for me, but before I answer it, I'm going to give a shout out to Katie and all the other folks out there that are homeschooling, all you brave, courageous folks out there that are dealing with this pandemic in a way that you could have never imagined. I have 2 kids, thank God they're grown, and thank goodness they never had to face me homeschooling them, because I don't know where they'd be right now if they had to endure that. But all joking aside, for the folks out there, there is plenty of behavioral health capacity, albeit through virtual health. There's plenty of behavioral health capacity, and if that isn't your thing, there are still all the other normal resources that you would have at your disposal, like MIFLIX or chaplains or other avenues to get help and support. It just is through physical distancing, not social distancing, but physical distancing. So there's no need to feel alone. There's no need to feel like you're the only person under this type of stress, and there's no reason that you should not think that there aren't folks that you can turn to for support and assistance. But the question for me, what do I see as U.S. Army Europe's biggest challenge in dealing with COVID-19? And I would say our biggest challenge at this point is when and how we resume some form of normal life, and how we resume that without reintroducing risk into our bases, into our posts, and into our communities. Everyone is anxious to get back to work. Everybody's anxious for the kids to get back to school, especially Katie. And the weather's getting nice outside, and folks want to know when can we just get back to normal life. I will say the chain of command here in USER takes that very seriously. They're applying a lot of energy towards how to phase people back to work, how to do it in a manner that is safe, that is prudent, that doesn't reintroduce risk unnecessarily. And I'll say on behalf of the Surgeon General, the whole Army medicine team, from the folks at the research labs at Fort Detrick that are trying day and night, to pursue a vaccine and other methods of testing, to the lab folks that are fielding more capability every day out to USER so that we can do the testing we need, to our great public health experts that are watching how this pandemic is playing out across the globe so that we can give good advice to our senior leaders about how to bring life back online. You've got a lot of energy behind how to do it, and I think our biggest challenge is that we trust that the leadership and the experts are working tirelessly to make sure that we do it safely, and if you just have a little bit of patience and trust, we'll do it in your best interest.
Thank you, ma'am. Our next question is from Sean, and this question is for you, Colonel Contino. Sean wants to know, is secure messaging still working? Is it still an option for him to communicate with his provider?
Yes, that's a good question. Secure messaging is still working, and you should be getting a reply within 24 hours, and we certainly would want to know if you're not. This is a system that's been in place for several years and underwent a name change from Relay Health over to Change Health. But secure messaging is definitely a great way, and TRICARE Online is also another way to make appointments and communicate. But that's something that you can certainly sign up for in the clinic, or in this case on the phone through the appointment system, and get some information on. So that's certainly alive and well, and I'll take this opportunity to put put in another plug for the virtual process of seeing patients, whether it's, as Dr. Wyman said, with behavioral health or for any primary health care needs. So please take advantage of that. Providers are all given a list of the types of things that they can do virtually. We have over 200 providers at Launchstool, the virtual health center there is trained across the entire area. So just because you're in Grafenbeer doesn't mean you can't do a virtual encounter with your provider at the Grafenbeer clinic. One important thing to know is if you do get an appointment virtually, whether it's through secure messaging, as the question referred to, or on the phone, please make sure you follow the instructions that you receive very closely, and everything should turn out well. There's now also a new feature that allows you to kind of self-test the connectivity. That's very important, and those instructions will come with your appointment information. Thanks again for the question.
This question is for Colonel Coldren. How do trace teams determine who to inform that they were around someone that tested positive? Should it be everyone they were close to in the past 7 to 14 days?
So it's not 7 to 14 days from the time somebody is sick. We don't go back 7 to 14 days from that time. The 7 to 14 is the amount of time somebody would be quarantined from the time they were exposed. We only go back about 48 hours because it's believed that a person may be spreading the disease, even asymptomatically, for 48 hours before they develop symptoms. So it's important for us to go back that amount of time from the time the patient develops symptoms, go back those 48 hours to make sure we capture everybody who was in fact a close exposure and who needs to be placed in self-isolation.
Okay, this one's for Colonel Contino. What is the best form of treatment for those who are COVID-19 positive?
Okay, so if you are COVID-19 positive and you're asking this question, how am I going to be treated? There is no medication that specifically has been proven to kill COVID-19. So the main treatment is supportive care. That's similar to the treatment that you use when you have a common cold, which is also another virus. So that may include the measures that you take at home, whether that's acetaminophen, rest, fluids, eating healthy food, and as Dr. Wyman said, with the rest, the actual amount should be roughly 7 to 9 hours a night based on your age and your own individual requirements. Now, if you develop more symptoms with your COVID, where you develop shortness of breath or a worsening cough, or you have any other symptoms related to it, like severe diarrhea, and you actually need treatment within the hospital, that care is usually still predominantly symptomatic. So even if you take a situation where someone in very rare situations needs the support of a ventilator, that's still considered supportive care because we're supporting your respiratory status. Now, yes, there are investigational medications out like remdesivir and hydroxychloroquine's been on the market for a long time. It does have an indication under emergency use to treat for COVID-19, but there's no one medicine that's been proven. So while you may be offered that medicine if you're in the hospital, it doesn't necessarily mean that that medication is making you better. It may be that your own immune system, along with the support you're getting, is doing that. Again, if we back up to the cases of COVID-19 patients who don't require hospitalization, which is the vast majority, there is no medication that is recommended and is certainly required at that time. Thanks again.
Okay, our next question is from Jasmine, and it is for Colonel Freeman. How do I refill my prescription? Are there any changes to pharmacy operations happening right now?
So thank you for that question, Jasmine. Pharmacies are still dispensing medications at our NTFs across Europe. The hours may have some adjustment potentially, and the method in which the medication is dispensed may differ in some respects also depending on the MTF. There are some MTFs, for example, that are offering as an option drive-through pharmacy dispensing. But yes, our pharmacies are absolutely still dispensing medication. So I encourage you, if you need to pick up a med, to go in, wear your mask, use hand hygiene, and pick up your medication from the pharmacy as prescribed. If you are in quarantine or isolation, however, then I encourage you to find a friend, a coworker, a family member, somebody to go in for you. Please don't break your isolation or your quarantine in order to go pick up a medication instead of having somebody else do that on your behalf. Thank you.
Okay, thank you, sir. This question is for me, and the question, I apologize if I say your name incorrectly, but it looks like Brandis or Brandi. And so the question is, we are supposed to PCS this summer to another overseas location, but need to get medically cleared before we can get orders, so that's through the EFMP process. What is a ballpark estimation when we can reschedule those appointments to continue this process? Well, most of our NTFs are still seeing patients for routine things depending on the circumstances. If you are PCSing here in the near future, there are exceptions to policy that have been done recently to allow individuals to PCS from our current location to another location. And so I would recommend that you reach out to your local military treatment facility on the availability of your appointments, and based on that medical screening through EFMP, those appointments should happen fairly quickly. But if you are having issues, then we ask that you reach out to your MTF and figure out how we can get you best seen as soon as possible based on your PCS timeline. We are here to support you, and we recognize that everyone's circumstances are a little different from other people. But thank you for the question.
Okay. This one's from Sarah for Colonel Freeman. When will Leinstuhl start accepting new appointments for services that cannot be taken care of at our local MTF?
So that is a very good question. I don't know. Can't put a timeline on it right now. It is truly dependent on how things progress with the coronavirus crisis that we're dealing with right now. As Sergeant Major Baller said, we are still doing some routine appointments, but they have been dramatically scaled down because of all the other competing requirements that we have in responding on a large scale to the coronavirus outbreak. So we're primarily doing urgent appointments. That being said, there are still routine appointments that are occurring through virtual health. Virtual health has been mentioned several times tonight, and that is a very robust and growing increasingly more robust avenue in order for us to still continue serving our community, because that is our goal, to continue serving our community even while we're making our way through these uncertain times. So I don't know when we will start returning back to our previous normal state, but in the interim, please don't hesitate to reach out if you have something that really needs to get taken care of, and we'll find a way to take care of you. Thank you.
This question is for Lieutenant Colonel Winans from Kenneth. Is there a difference in care provided for patients who have a face-to-face appointment versus a virtual health appointment? Do we get the same standard of care? You're on mute.
All right. Tanya for Colonel Cauldron. What over-the-counter medications do you recommend to have at home for adults and children to prepare for a mild case of COVID-19?
There's not one that has been shown to be particularly more effective than the other in terms of reducing fevers. So Tylenol or Motrin, either one of those or both are actually shown to be quite good. But it's also a good idea to have plenty of hydration fluids, and if you are not somebody who likes to drink just plain water, make sure you have enough flavor crystal powders to make the fluid potable and pleasant tasting for you, so that you can take enough fluids. We definitely want to avoid taking too many caffeinated beverages when we're sick. So particularly sodas with caffeine, which are both high in sugar and in caffeine, can be doubly poor choices to use as rehydration fluids when you're sick. So you should try and make sure you have enough of those kind of supplies on hand. And that's really the best you can do to prepare. Thanks.
Okay, Colonel Winans, we couldn't hear your answer. You had your mic on mute. Could you say again over?
So Colonel Winans is still muted, but maybe I can help answer this question. I have a behavioral health background, and in fact today we're speaking with Colonel Winans about all of the options that are available for our family members, for our soldiers in our communities all over Europe. And right now the primary mode of behavioral health treatment is through virtual health. And that level of care is without a doubt the same level of care you're going to receive either face-to-face or virtually. Now I can share that the initial feeling of it could feel a little awkward, talking to somebody through a video screen, somebody on the other end, but I will encourage everyone, if you are going through a difficult time and you'd like to talk with somebody, then if you can only do it virtually, please just ask that you give it a try. We have some incredible providers that are here to support you, and we will start your treatment virtually, and if you require additional treatment once we're able to see you in person, I can assure you that level of care will be consistent, and that when you're able to come into the office, you'll be glad to meet your provider face-to-face. But thank you for the question.
Command Sergeant Major Bada, this is Colonel Contino here. I actually just spoke with Dr. Winans this morning and almost every day on this topic, and I would echo that and say that just so everyone knows, about 90% of all behavioral health encounters now happen virtually. And the standard of care is certainly right up there. I don't think there's any substitute for face-to-face, but that said, because behavioral health visits do not require blood pressure and height and weight, that I think you can expect the same quality of care done virtually as you can face-to-face. So I definitely think people should take advantage of that, especially in times now where your whole physical, social, emotional, financial well-being is being challenged. Thanks.
Thank you, sir.
Hey, this next question is for me from Rose in Vincenza. She just wants some assurance that the hospital, the host nation hospital, San Bartolo, are now allowing husbands back in the delivery room when they're having their babies. Ladies are having their babies, their families. And exciting news. The answer is yes, Rose. Husbands are allowed back. I'm sure they'll be wearing the proper personal protective equipment. However, great news that husbands are allowed back into the delivery rooms.
Okay, this next one is from Liz for Colonel Pozo Alonso. I know dental is just for emergency only, but is it for active duty emergency only? My German provider has closed, and I know I need to get in to see a dentist.
Absolutely. If you feel you have a dental emergency, you must call the dental clinic that is near your area where your spouse is being treated at, and let our professionals evaluate you and determine what kind of treatment, or if you need any treatment or something that can be taken care temporarily with some medication. But yes, we are here to support our community, and if you feel you have a dental emergency, please do not hesitate to reach out to us. Thank you for that question.
Okay, and then the next question for me from Jennifer. What happens if Germany releases restrictions but DoD has different policies? Will we have Europe-specific guidelines based on local guidelines? So Jennifer, and for all the folks out there, we will certainly be respectful, just as we are now, with the local national guidelines. Germany and Italy and the other countries that we have soldiers and families stationed in. But the USURA commander, in conjunction with the EUCOM commander, will evaluate and adhere to DoD guidance as needed. And in specific cases where they feel that the DoD guidance doesn't cover specific cases for Europe, or needs to be amended specifically for Europe, particularly for readiness reasons, then they will address that, but they will ultimately follow DoD guidance, again, respectful of local guidance, but always, always, always in the best interest of the safety and care and health and well-being of our soldiers and our family members.
Thanks, Mia. Okay, our next question is for Danielle, and Colonel Winans, this question is for you, so hopefully you got your sound fixed. I'm 16 and really missing my friends. This lockdown is so annoying and I'm getting really depressed, but I don't really want to talk to my mom and dad about it. And I don't really know how to get a hold of my school counselor. What can I do?
Okay.
Okay, so we're still having some technical difficulties with Colonel Winans, but for anyone, if you're 16, if you're an adult, we ask that you talk to a family member or a loved one about some of the things that you're struggling with. This is not an easy time for anyone, and we can certainly recognize that each of us are having our own challenges and working through this. And so I would encourage you to talk to your family members and your loved ones, because your family members and your loved ones can assist you in getting some help and talking to somebody here within one of our military treatment facilities. And especially if you reach out to Lonsdale, we can help you in that capacity as well. But thank you so much for the question. I have a 16 and 17-year-old at home as well. And I know getting some of their feedback, we're all getting a little frustrated, but just ask you hang in there and stay tough.
And then Danielle, I think we can follow up on Facebook. We can provide you some numbers. We can provide you some numbers to some alternate places where you can go to get express yourself and seek some help and some counseling.
Okay, this next question is from Colonel Contino. Karen is asking, I saw an article that if we were charged for COVID testing, that we would be reimbursed. Is that true? I'm a DA civilian.
So we take this very seriously, that when it comes to public health matters, just like we try to give out flu vaccines in the fall time to as many people as possible, when we're faced with something like a crisis with COVID-19, that we're going to do everything possible to make sure that people are not billed or perhaps reimbursed would be the way if there's a situation that has already happened and we need to go back and make good on that, we're working through that. There are still, I think, a few glitches, but our patient administration division tells me that they fixed those. So I would encourage you to contact the TRICARE Service Center or the clinic and get further direction on getting this resolved. We want to and will get this resolved for you. Thanks.
Okay, and then for Colonel Calderon again, can you please explain the sustainability of the virus to live on different surfaces, and what is the best way to disinfect those surfaces?
Sure. The very good study came out a couple weeks ago, actually, which showed that the virus does not survive an especially long time on surfaces. Metal and plastics, it tends to survive no longer than 48 hours, and on cardboard, no longer than 72 hours. This can be shortened by a number of conditions, such as sunlight. UV tends to kill this virus, but the virus can survive up to those lengths of time. And normal household disinfectants are actually quite effective against this virus, whether it be a dilute bleach solution or typical household sprays. They are all fairly effective against coronavirus if used as directed on the bottles or on the container. So that's a good question. Thanks.
Thank you, sir. Okay, ladies and gentlemen, so we have time to take one more question, and so our final question will come from Justin. And Colonel Contino, this question is for you. I'm mountain bomb holder, and I have a couple soldiers in restricted of movement. Who's the authority to return them to work? Somebody from the hospital or from my battalion?
So good question. We want our public health emergency officers, are called FEOs, to work with the unit commanders to make this decision. In some cases, if there's a mission requirement for a service member to be released at a different time based on a kind of a comprehensive risk assessment, that still is through the FEO, the public health emergency officer, and the local command. That would just be elevated up to the SRO, the senior responsible officer. So there's a process for that. It's just not a matter of kind of checking your time there, recovering, or whether if you're just on a quarantine status, releasing yourself at that time. So please do check through your command to make sure that process is followed. Thanks for the question.
Well, thank you, sir. And I do want to say thank you to our entire panel. Colonel Winans, I'm sorry we could not get to you, but please, we will look forward to some of your responses on Facebook to get back to some of the questions that you're unable to answer. But thank you all for your insight and your support to all of our communities and our beneficiaries all throughout Europe. So thank you again, gentlemen. And to everyone on the net, we appreciate you so much for joining us this evening. We apologize that we were unable to get to all of your questions, but as I said, when we opened up this evening, we will do our best to get online, review all of your questions, and make sure that we provide you an answer on site so that everyone has an opportunity to view those questions and answers. I can't thank you enough for all that you continue to do to protect yourselves, your family members, and all those around you by continuing the physical distancing, washing your hands, and avoid touching your face, and avoid going to places that you could potentially unintentionally infect yourself with COVID. So thank you for all that you do. We also wanted to publicly thank all of our healthcare providers all throughout Europe for doing an incredible job to take care of each of you. And again, if there's anything that we can do, please let us know online. Thank you again.
Ladies and gentlemen, as mentioned previously, our team will go back through any questions you posted that were not answered and provide answers during the coming days. We want to reassure everyone that our senior leaders and medical professionals are doing everything we can to ensure you that we have the medical support within your communities, whether that's through our host nation facilities or augmented medical forces. We will continue to provide the highest level of patient care to our supported communities. Our hearts and prayers go out to everyone grieving for a loss of a loved one, those currently battling COVID, and to our healthcare professionals throughout the world who are working diligently to treat those affected with COVID-19. We each play a critical role in our prevention efforts. We must continue to maintain our social distancing, wash our hands, and avoid touching our mouth, nose, and eyes. With a united front, together we can prevent the spread of COVID-19. Thank you.
Okay, folks, listen, thank you all for your time this evening, for your engagement, for your questions, and for staying safe. On behalf of the Surgeon General and the team here assembled, we could not be more proud of Regional Health Command Europe, you all, in addition to being caught up in this pandemic, you are also at the forefront of keeping the rest of USER safe. Our healthcare professionals, we can't help keep others safe if we don't keep ourselves safe. So again, it's imperative that as you have questions, as you need support, as you need to reach out to the command, that you do so. Our regimental crest says to conserve the fighting strength. That's our duty. And it starts with ourselves. And so I would just say, you do not have to wait for us to host a town hall to ask us questions. There is a lot of information out there. It changes daily. It bombards us on the news and in the newspapers and on the television. And so if you at any point in time need assistance, need help, have questions, aren't clear on how to get that help, please reach out to the command through whatever means, Facebook, phone, email. Do what you need to do. Help us help you. We are here to support you, and we appreciate you, and quite frankly can't do enough for you, because you are just at the tip of our response plan across USER. And so thank you. Thanks for all you do. Army Medicine, Army Strong.